Hi, I'm Dr. Leo Stouter, and this is Anatomy on the Beach. So let's talk about the lower extremity. Remember that when we talked about the pelvis, that we have this cup called the acetabulum. The acetabulum is going to be the cup, and then you're going to be having the head of the humerus fit into that. And we call this a ball and socket joint. It's a very, very stable joint. Therefore, it has decreased amount of motion. As you know, you can't move your leg as well as you can your arm. So we give up something for stability. So we have stability, and then we have decreased motion, or we have instability in our shoulder, and we have increased motion. It's sort of like, well, when you're single, you're really, really able to play the whole field. But once you get married, you are going to be more stable, aren't you? And you also are going to be less free. So when we look at the head of the femur, we see it's going to be fitting into the acetabulum. As we go lateral, we'll see that we have this big portion of the femur called the greater trochanter, and this portion underneath, which is going to be called the lesser trochanter. Then as we go down the shaft of the femur, we see on the posterior that we're going to be having this line called the linea aspera. Linea means line, aspera means that it's going to be very rough. As we go more distal, we see that we have our patella, which is going to be fitting anteriorly on the femur. And we also have both condyles. We have a lateral and a medial condyle with an area in between called the intercondylar something or other. Called the intercondylar groove. That's it. So we have the lateral and medial condyle, and in between we have the intercondylar groove. In addition, we also have the articulation with our tibia at the tibial plateaus, both the lateral and medial tibial plateaus, with, in the middle, the tibial eminences, which are actually these bones that are sticking up a little bit. Laterally, we have the fibula, and the fibula is a non-weight-bearing bone, but distally it will create the ankle mortise. And the ankle mortise is going to be the tibia and also the fibula laterally. The inside portion of the tibia is going to be called the medial malleolus, or the lateral portion is going to be called the lateral malleolus, and that's also going to be the portion of the fibula.